So, first, I want to introduce Dr. Claudine Jurkovitz. Claudine is the principal investigator for Partners in Research Project. She is the senior physician scientist in the Value Institute of Christiana Care and director of the Biostatistics, Epidemiology, and Research Design Core at the Delaware Center of Translational Research, the ESSEL program. As a nephrologist epidemiologist, Claudine has actively developed her own research interests, mostly in the field of chronic kidney disease and in health services research. She was recently awarded a big data pilot grant through the ESSEL program, linking data for kidney care, to build a CKD registry in the state of Delaware by linking electronic health records to predict hospitalizations in patients with chronic kidney disease and examine the transition from pediatric to adult care in young adults with CKD. Please join me in welcoming Dr. Jurkovitz.
Well, thank you very much, Tim, and thank you very much to all of you for being here at our second annual Partners in Research Conference, and welcome. So I have no conflict of interest. So I will review briefly this morning the mission of PCORI, and I'll describe the progress of our program, the results, today's agenda, and then we'll outline the next steps. So a year and a half ago, approximately, we received a Eugene Washington PCORI Engagement Award to engage stakeholders for a patient-centered research agenda for chronic kidney disease in Delaware. So PCORI is a patient-centered outcomes research institute, which is an independent non-profit organization, which mission is to fund research that will provide patients, their caregivers, and clinicians with the evidence-based information needed to make better informed healthcare decisions. And PCORI is committed to continually seeking input from a broad range of stakeholders. So this is our funding agency. So what did we do with this funding up to now? We assembled a team of stakeholders, and as soon as we did that, we rushed to organize the first conference. Here is our team. Here. So Nancy Scott here is the Director of Education for Dialysis Patient Citizen and one of our patients' partner. Bill Murray and Steve Scott, our patients' partner. Joanne Smith is a dialysis manager and a patient advocate. Shay Scott is the Director of Operation at Henrietta Johnson Medical Center, a federally qualified health center. Sarah Faye Dolman is a research associate in the Value Institute and our Fairless program manager. Our two interns, Alexa Meinhardt and Ollie Archinol, and Nicole Harrington here is a research assistant in the family medicine program. Other members of the team include Tim Gibbs, whom you just met, of the Delaware Academy of Medicine, as well as Kate Smith. Dr. Heather Bittner-Fagan is a primary care physician in the family medicine department. Dr. Ruby Nisrani is a nephrologist at Nephrology Associates. Dr. John Swanson is a surgeon, the chief surgeon in the transplantation department, and Dr. Zaritsky is a nephrologist at DuPont Hospital for Children. So what did we do? Exactly a year ago, we organized the first conference, and some of you may remember, we informed the community on the state of chronic kidney disease in Delaware and nationally, on the issue of disparity in chronic kidney disease, and also on patient-centered outcomes research in chronic kidney disease. But most importantly, we began a conversation with patients, their caregivers, healthcare providers, about research questions and outcomes that are most important to all stakeholders. And we did this during workshops in the afternoon of the first conference. So what did we obtain? All the community identified 122 questions that we grouped into themes, and these are ranked by order of importance. So, for example, 17 questions were related to CKD education, 15 questions to medication and treatment, 12 questions to medication and treatment. Here it didn't show up, but that was communication and coordination, which was 15 questions, 12 for medication and treatment, etc. So what else did we do in this year? we took all together, all our stakeholders, a community academic research training course, and we followed the Axel Community Engaged curriculum, which was developed by Dr. Bittner-Fagan. And I must say that it was a really wonderful and very enlightening experience. We learned a lot from each other, as well as from the faculty in the program. And we also organized town hall meetings about patient-centered outcomes research, comparative effectiveness, end-of-life issues, as well as the confidentiality and security of data. And now here we are at our second conference. So today, what will happen today? We are going to focus on patients' and caregivers' experience. We will first learn about the challenges in the transition from childcare to adult care. And we will also learn about the patient experience in the hospital. We will discuss the caregiver perspective, and we will understand the patient experience with kidney disease. We will learn about the renal rehabilitation exercise program in Delaware, and also we will discuss the patient's perspective about living with polycystic kidney disease. And finally, we will learn about the program Prepare Now from Geisinger, which is putting the patients at the center of kidney care. So please hang on to your hats and stay with us. So next step, excuse me, when at the last conference, so in the afternoon workshops, we had a really wonderful turnout, and people were very engaged and, obviously identified a lot of questions that were that they wanted to be resolved with research. However, we realized that when we did further analysis that we didn't have as many patients as we expected and not as many as caregivers as we expected. So we decided, and so we were worried that, in fact, the themes that we ranked were not really representative of the opinion of the patients and caregivers. So what we decided is to, out of these themes, we developed a number of questions out of these 19 themes. We put them together on a form, and we are going to distribute these questionnaires to the patients and caregivers, again, to rank these questions, and we will distribute them directly, give them directly to the patients and caregivers. And we will do this in the next 2 or 3 months. After that, once we have these results, we'll host a workshop comprised of equal number of patients, caregivers, healthcare providers, researchers, and administrators. And the goal of this workshop will be to choose the survey questions that are preferred by everyone, among those that we have identified and have the highest rank, and also to reach a consensus on which research questions we should focus for the next few years in Delaware. And independently, we would like to begin a conversation about sustainability of our program and how we can keep this program going on. So please stay involved and visit our website. Sign up for the workshop, and all the information will be on the website. All the results of the ranking will be posted on the website also, as well as the decisions about which question to pursue. And now I would like to present a little video that we did from our last conference. It's only 3 minutes.
The goal of this workshop is to apply our research in a way that patients see as valuable.
To know exactly what data we need to collect, and also what research questions they are interested in to improve the care of the patients and to improve the quality of life of the patients. We don't want to do research in a vacuum.
Chronic kidney disease is a very significant disease for all populations. So today's conference is really an effort for the state of Delaware to get all of the stakeholders working together in a coordinated fashion to address the major issues of concern.
Research is really most effective when it's being driven by questions that are going to ultimately matter to patients in the long run.
Patient perspective and caregiver perspective are critical. It's great that providers have all the knowledge in the world and have all the resources and know who to go to for what, but unless that is shared with the patient and the caregiver, it doesn't do any good. I got an email telling me about today's event, and I think probably within about 10 seconds of opening the email, it's like, how do I register?
There has not been much change or modification to dialysis treatment in the last 30 years.
Today was really the first step of our 2-year program. We had speakers in the morning to set up the stage of kidney disease, and in the afternoon we are doing work groups to really identify the most important questions that stakeholders are interested in.
I think there's a lot of strength in hearing, those different perspectives kind of brought together.
Any investment that can be made to reduce progression and preserve, kidney health will have significant downstream positive impacts on a number of different levels.
The last speaker talked about the financial issues and these other types of things, but ultimately the patient is going to benefit if we all sort of put those things aside and realize that patient should be center stage for all our decisions.
People want to be engaged and want to participate, and I think this is great.
These kinds of things are just so important, and having the access is critical.
So here we are, a year later. Now I have my last slide. Oh, that's not this slide. Here we are. So this is the most important slide. I wanted to thank everyone. I wanted to thank the Value Institute administrative team who has really extremely helpful in organizing this program. The Value Institute leadership who enabled the program and provided us with the resources to organize the conference. And all the Partners in Research team. And I'd like to specifically thank Holly Archinol and Alexa Meinhardt, who are our intern. Holly really put together this video, was instrumental in putting together the video and in organizing also the video today. Alexa was instrumental in organizing the conference today. And a big, big thank to Sarah Fay, who has been our program manager since the beginning and who unfortunately is leaving us for new adventures at the end of next week. So thank you very much.